Hello, it's Dr. Shelley. And as I promised, I'm coming at you with a couple of updates on the latest in terms of infectious disease and how this affects you. In other words, we've got measles in Texas and now basically about 10 other states. And so it is growing. And how does that even impact you and your family, especially with spring break coming up and our little college kids going off in their bikinis and their short shorts and doing their thing? What about tuberculosis? While that won't be the focus of this video, you should be aware that we currently have the biggest tuberculosis outbreak in the history of the United States, right in Kansas and even Nebraska. Not cool. We also have some concern about the flu. We are still technically in flu season, and the deaths from the flu, especially children, is rising very, very shockingly. And then, of course, there's the bird flu. Did you know, if you live here with me in Ohio, we are the #1 state for the bird flu? Those are just some things you probably should just be aware of. Now let's give you tools you can use, because I do want you to know about measles. Measles it's like the biggest issue you need to educate yourself on. Now, why? Well, here's the deal. As you know, I teach students, nursing students, med students, nurse practitioner students. And what I teach them, something that all of you need to know as well, is that the most infectious disease on earth is the measles. So come with me, let's kind of go over what's been going on so you can kind of, look out towards protecting your family. Measles, which is also called rubeola, which you don't care, but my students do because it's on their test. Measles is called rubeola. In February, as a matter of fact, I'll never forget it, because on February 8th, I taught all my students about the infectious diseases. I talked about measles because the day before, there was a news story about there being an outbreak in Texas. Texas this year was the first state to have this large group of measles cases. And the number of cases at that time was 24 cases. February 8th, we had 24 cases. Now we have 1 death, and we haven't had a death from measles in a child since 2003. We haven't had a measles death in an adult since 2015. So this was big. Now, March 6th, today, March 6th, we have a new case of measles in Florida. So what are we doing so far? Florida, Miami-Dade County in Florida is today's new case. You can only imagine where I'm going. Spring break, you got me. There are 11 total states that we know of. We'll talk about how contagious this is. There is Alaska, California, Georgia, Kentucky, New Jersey, New York, Rhode Island, Washington, and New Mexico. To put that in perspective, we have 159 cases as of right now in 2025, up from 146 cases Friday, just a few days ago, and 90 cases a week earlier. To put that in perspective, because I'm trying to go somewhere with you, I need you to stay with me. The 159 cases that we have right now for the year 2025, year to date, March 6, 2025, how does that compare? Because your boy, Bobby Kennedy, said this happens every year. He's smoking. So let's go into detail. We have 159 cases as of right now, year to date, March 6th. For the entire year of 2024, last year, we had 285 cases. That was for the whole damn year. The year before that, 2023, we had 59 cases of the measles. Again, this is the most contagious disease on the planet. In the 1980s, globally, and I do need you to know what your rest of the world is doing, even though some people in Washington want you to isolate yourself and just think of yourself as little old America that can handle whatever comes over their way. but I need you to think in the bigger box. Globally, when we looked at measles in the 1980s, it was the #1 killer of children globally. As a matter of fact, we averaged about 3 million deaths in the 1980s. Now, with vaccines, we got it down to about 100,000 deaths annually on a global basis. But here's the key. In the United States, by the year 2000, we had 0 cases. Yeah, I said 0 cases. Okay, so we thought, oh, we have eradicated measles. Not so much. Now, you might be thinking, okay, how bad is measles? Well, again, it is the most contagious disease on the planet. If you look at 10 people exposed to measles from one patient, 10 people exposed to measles from one patient, 9 of the 10 will get measles. That's even after the person that was in the room with the measles left 2 hours ago. So picture that. Someone in the room with measles who left the room within the last 2 hours. If 10 people enter that room, 9 of them are going to get measles. That's how contagious this is. So we're about to explode in this country with measles. I need you to know that. Now, when we look at who in this country right now is getting measles, 5 to 17-year-olds, 5 to 17-year-olds. As a matter of fact, the Miami-Dade County case in Florida, that kiddo is a high schooler. Out of all the cases that we've had in Texas, and just in general lately, only 5 were vaccinated with 1 shot at least. Everybody else was not vaccinated. So only 5, and maybe some of them only had 1 shot, and that's important because look what I'm telling you. If you have 1 MMR vaccine, measles, mumps, rubella vaccine, that is 93% effective. If you've had both your shots, which you usually get at 12 to 15 months, you get your first shot. Then you get your second shot, the booster, right before kindergarten, between 4 and 6 years old. So if you've had the 2 shots, that's a 97% coverage for that person. Like, they're pretty good. That's pretty damn good. And I say that because nurses have asked me, hey, Shell, should I be worried about this measles? Probably not, because all of nurses and doctors and respiratory therapists and different people who work in the hospital, we actually can't work in those hospitals without getting our titers drawn and checked for whether or not we're immune to measles, mumps, and rubella. If we're not, we're recommended to get a booster or we can't work there in the hospital in most cases, okay? Especially me over at the Cleveland Clinic. So I'm not really worried about nurses and doctors. So I really want nurses and doctors to just help me educate the general public who should be a little concerned right about now, okay? Now, I want my wonderful family, Instagram, Facebook, YouTube family, I want you to know what to look out for because this is so damn contagious. Here we go. We call this signs and symptoms. We even have something called the 3 C's, and we'll talk. But the signs and symptoms are really important that you notice early signs and symptoms versus late. And some of you will never notice any of these symptoms because it takes a clinician to know what to look for. But then others, these symptoms are very obvious. So let's go from the very beginning. Here's what you got to keep in mind. Just like the chicken pox, measles is contagious 4 days before you have any symptoms, and it continues to be contagious 4 days after all your symptoms are gone. So here we go. For the first 2 to 3 days, there's something called Koplik spots. These are white and sometimes blue spots on your buccal mucosa, nurses. For my regular folk family, that would be on your gums, okay? That would literally be on your gums. You'd have these crazy white spots on your gums, okay? Some are gonna look a little bluish as well. That would be the first 2 to 3 days after you're infected. The next thing that we would see is this red rash. Now, my students know that almost all rashes start on the face, except for chickenpox, which starts on the trunk. Well, this is no exception. This is measles. It starts on the face, but it normally goes around the hairline. Specifically, it's going to be back up in here, on your neck, on this kiddo's neck, around the hairline, on the face, maybe even in here, and then it's going to spread throughout the entire body, the feet, the legs, the arms, the trunk, the body, everything. This red rash is going to just move on down the body and be all over the place, okay? Now, once the child has this red rash and it's bumpy and it's all over, this is when they usually spike a very high grade fever, 104 degrees, okay? So we're talking 104-degree fever, a rash all over the body, plus this child has a cough, a runny nose, and pink eye, conjunctivitis, a watery pink eye. We call it the 3 C's. Cough, nursing students, coryza or coryza, which just means runny nose, nursing students, and conjunctivitis, 3 C's. But for regular folk, basically your kid's got a cold with a rash, right? And a high-grade fever, like, oh no, not cool. All right, so this is some things you need to know. This fever, the runny nose, the conjunctivitis, this is usually 7 to 14 days. The whole thing with the red rash is going to be about day 3 to 5. So in the very earliest symptoms, you're going to have the spots on the gums in the first couple days. A few days after that, a day or 2 after that, you're going to see the rash. And then we get that high-grade fever, cough, cold, whatever. So you got it. This is the deal. Now here's our problem. Our problem is that this child does not need to be hospitalized at that point, but the doctor does need to know. And some of us, not all, I know I enjoyed having the best, but some of us have a really cool pediatric group that we send our kids to, and we can call that pediatric group and actually talk to a pediatrician and actually tell them what's going on with our child and have a big, huge issue avoided. What is the big, huge issue? This child has no business in anybody's doctor's office or hospital with the current symptoms that I just gave you. Those symptoms can be managed with the communication with your pediatric group, and they would tell you if you need to come in, and if you do, they're not going to have you come in the doctor's office, because in the doctor's office, you're going to infect everybody in the waiting room. They're going to have you go to a hospital, and they will tell you when that is. If you are worried, if you're scared, get your butt to the hospital. Don't hesitate. But the doctor's office, probably not the best place for this child, because everybody and their mother-in-law is going to get infected. Okay? Now, let's look at the complications, because we said that this child died. Okay, this child with the measles died. We've had 1 death, and it's tragic. This is a school-age child. They were not vaccinated, and they freaking died. Now, what are some things to think about? Because it is rare. I need you to hear me, right? Faith over fear. It is rare to have the complications. But what are the complications? What should you be looking for? Well, one of the complications is measles pneumonia. Just like the chickenpox, you can get pneumonia. But with measles, it's a higher risk. So you could get pneumonia and have outright respiratory distress from this pneumonia. And if that's happening, I gotta tell you, 20% of people with measles that end up getting hospitalized, it's usually from respiratory distress or something we call in my classroom neurological symptoms, or which a part of that is encephalitis. Encephalitis is a disease of the brain, and that's bad. That's neurological disease, and that is bad. And that's why I said 20% of kids with the measles will be hospitalized, and they are generally in the ICU. So we have pneumonia, we have encephalitis, we can even have a measles diarrhea / dehydration. Yeah, they've got to be hospitalized because they're not doing too well either. Unfortunately, especially those children who get encephalitis, deafness is a complication. Seizures, because that's neurological as well. Yes, that is a complication. And then you see death. It's way down the list. It is rare. You see, we only have one, but if it's your child, it's not what you just don't care. That's not rare to you. It's your freaking kid. Okay? Now, what about pregnancy? Oh my goodness. Pregnant women have a naturally low immune system. So a cold in a regular person is the death of pneumonia in a pregnant woman. And because she's immunosuppressed, she is prone to getting these infections. And these infections do cross the placenta and cause complications. What kind of complications? Premature birth, low birth weight, and the worst of all, which is a stillborn baby. And that's a baby who died inside of this mom and now is delivered into her arms, gone, dead, like not cool. Okay, so that's the pregnancy issue. And then of course, number 8 is the immunosuppressed patient, and this is your chemotherapy patient. This is your patient on steroids. Maybe it's the patient with multiple sclerosis or myasthenia gravis or Guillain-Barré or lupus or sarcoidosis or inflammatory bowel disease like ulcerative colitis or Crohn's, and even psoriasis. These patients are on medications that suppress their immune system, making them very much at risk of, even though they may have been vaccinated, they can catch the measles because their immune system doesn't respond. And that is where we are right now with this situation. Now, you know that there's a vaccine. The vaccine is called measles, mumps, rubella, MMR. A reminder is that this is something that we got when we were over a year of age, so 12 to 15 months of age, and then we got a booster right before kindergarten. But there is a lot of hesitancy towards vaccines, and we'll hit on that in a minute. But here's what I don't know if you know, and I want to make sure you know. Let's say the worst has happened, right? Let's say that your kid comes home and a kid in their class, you're notified that they have a measles outbreak in your child's class. And maybe because of fear, and that's real, and we're going to talk about that, but because of fear, you chose not to get vaccines for your kids. If you want to revisit that, and I certainly would consider it, I mean, really, if you want to revisit that issue and you're kind of starting to wonder, was that the right decision? Here's what you need to know. Within 72 hours of exposure to measles, you can still get the vaccine to prevent the infection. It's that simple. We now, and it's been a few years now, but we now have the ability for people that were exposed in the classroom to go ahead and give them that shot within 72 hours to prevent the actual illness itself. That's important for you to know in case you want to rethink that. But let's visit the fear factor, okay? Because it's real, and I'm not mad at you. It's real. There has been so much controversy, including with this crackpot that is down there in Washington. There has been so much controversy with regards to does this vaccine or any other cause autism? And let me say this. I don't lie to my patients. Remember, I'm a provider. I delivered pregnant women for 20 some odd years at 5 different hospitals. Remember that? I am not going to lie to you. Here's my reality, and here's what I teach my students, and here's what I mean from my heart. As of March 6, 2025, there has been absolutely nothing showing that these vaccines cause autism in any of the research. However, what I do say to everyone in the medical field is I'm not going to stand here and guarantee you anything, because we know that we have seen where patients get something we thought was good for them, and 20, 30, 40 years later, we find out that it wasn't good for them. What I can say right now, because I like to keep it all the way 100, is that we don't have any evidence of autism being caused by vaccines. But what we do have is some controversy about some of the ingredients in the vaccines in the past. And that's important for you to hear, because even your girl, who's a parent of 2 beautiful daughters, 42-year-old and a 32-year-old, I raised the issue up when one of my kids was sitting on the exam table about to get a vaccine, and I was kind of shocked at what I heard. So I have to be honest with you. Here's honesty. One of the chemicals that we were worried about and certainly received a lot of attention is this word right here, thimerosal. It's mercury. Remember mercury? Remember the thermometers that used to have that silver chemical in it called mercury? And God forbid you drop that glass thermometer on the floor and there was that mercury bubble that you were like, ooh. Yeah, because mercury is not the greatest thing, especially when we talk about going through your brain and all this stuff. So mercury is not a great thing, right? We agree on that. Well, thimerosal has mercury in it, and it was used as a preservative for vaccines, especially if we had a large container with vaccine. We call that a multi-dose vial. So maybe you had a clinic full of kids and you could take that large container and draw your different syringes full of vaccine for all the kids that were there that day. You draw it all up and have it all ready, and here we go. Line them up, let's get them shot. That was a preservative. We know that mercury is not good. We know that it has the potential to cause problems with the brain, neurological system. And so this is where our country got to the point where year by year, and not immediately, no, not immediately, and that's where the controversy lays. Year after year, we stop putting this preservative in vaccines. So you might be saying, well, are there any vaccines today that have this preservative? Yeah, sometimes we see the flu shot having this preservative. That's important for you to know. So I was sitting there with my daughter, who I tried to get my kids to travel abroad when they were in their senior year. And my oldest daughter had won this cheerleading trip to London. So we paid for her to go over to London, and most of it was, accommodated because she won the trip. And then my youngest one went to China, and we sent her to China. I wouldn't send your kid to China now, but I sent her to China back in the day. So right before the little one went to China in her senior year in high school, well, I'm just getting her vaccines, because as you know, when you travel, you need certain kind of vaccines you may not need here. And I remember the vaccines being given to her, and she was, like I said, 18 or whatever. 17, she was her birthday's in the summer, so she was young. I asked her pediatrician, I was just joking, and I didn't like what I heard. I asked her pediatrician, I said, now listen, you're not giving my kid no mercury in that vaccine, are you? She goes, well, it's funny that you asked. She said, very often we have 2 batches of vaccine, and if the mother or father is asking specifically not to have any mercury or whatever. And this was way back when, because my kid's 32 now, but again, 20 years ago, almost 20 years ago. But yeah, we have 2 batches. And if someone specifically asks for no mercury or whatever, thimerosal, they don't give them that vaccine. And if nobody cares, they give them the other vaccine. I told this story to my classroom and I was very upset by what I heard. 2 of the people in my classroom, different times, one years ago, one not that many years ago, they both had worked in pediatric facilities where these vaccines were given. And they said it was based on private pay and Medicaid, and that they had to keep the vaccines in 2 separate refrigerators. And one of them even said she was written up because she gave a private pay kid the vaccine that was in the Medicaid refrigerator. Now, I'm just repeating what I heard, which is called hearsay. I wasn't there, but what I was there for was the conversation that took place with my pediatrician, who's also my friend, and thought she'd level up with me, but I was just kind of perturbed ever since that conversation. Here's what that means to me. It means that we have set up, just like we did with the Tuskegee experiment studying syphilis in Black males in Tuskegee, Alabama, we have set up a very large generation of people to not trust shit medical people say. We don't trust anything anymore. And that's a very awfully scary place to be. So I try to bring to you the best truth that I know, which is that as of right now, we don't have any proof, any studies to show that there is an association between autism and vaccines. But I also give you the honest to God truth in the fact that I can say as of right now, I'm not going to guarantee you shit. I'm not going to promise you a damn thing. I'm going to ask you to make an educated decision like I did, and for my children and my family, and to a certain extent for the greater good of society, I chose to get my kids vaccinated. I even put my 42-year-old in a research study to test the chickenpox vaccine to see if that was safe. She was 11 years old, and Dr. CHELLYS and Associates, very trustworthy group of pediatric teams. I hope you have that same pediatric team in Ohio that I do, at least in Northeast Ohio. Dr. CHELLYS and Associates, the best. He is very reputable. He's world renowned. So I trusted him, and it does all boil down to trust. I trusted him with this study, and it could have gone wrong, but it didn't. It's why we now have a chickenpox vaccine for our children, and they don't know how itchy it is to get chickenpox, and pregnant women don't get the horrible pneumonia and death-defying pneumonia that they were getting when they get exposed to chickenpox in pregnancy. And the elderly don't tend to see chickenpox that much, which they got pneumonia as well from chickenpox. So again, what am I saying? I am saying that we have measles, tuberculosis, the flu, the bird flu. We have all this stuff going on. You might not even know it because down in Washington, D.C., they are trying to hide things from us. How do we know that? Well, just remember what they did. January 21st, the CDC, which is the organization or agency that takes care of all of this tracking, treating, preventing, knowledge, and repeating and making sure they notify the entire country what's going on, they were taken offline. And instead of a daily report, they were told they can only report once a week. And so now they were taken offline. And then we as a country withdrew from the World Health Organization, which is stupid because a lot of shit over there can come here, because guess what? Americans like to travel abroad. They like to do things like go on cruises. I know I do. I love cruising. And so to just shut us off from the World Health Organization, which helps us know worldwide what's going on, is just fucking stupid. Knowledge is power. It's never harmful. Why would you do that? On February 8th, hundreds of CDC workers were fired. Now, I will say in the last 8 hours, they're trying to rehire a lot of them because of this shit here. They're sending all kinds of people to Texas because they know what I'm trying to tell you, which is that the whole fucking country is going to be coming down with measles any second now. So they're hiring the CDC people back. On March 1st or so, the FDA, Federal Drug Administration, cancels a meeting with an advisory groups and doctors and nurses regarding recommendations for what virus to track and make vaccines for next year. Wonder how that'll work out next year. You canceled that meeting. Wow, never been done in the history of the United States, canceling a meeting, the CDC or the FDA canceling a meeting about the upcoming vaccine for next year. Yeah, you should be a little worried about that. Then we have the average number of deaths from the flu every year is about 36,000 by the time we're completely done with the flu season, and we're not. Right now, we've had 21,000 deaths, and they're going up every day. So I need you to do your hand washing, okay? Use your hand sanitizer. If you feel sick, put that mask on. Don't go making everybody else sick. I thank God for my students. And I have a friend the other day, I was going to do some training with that person, and they called and said they felt a little under the weather, and I was feeling tired anyway. So I was like, okay, well, let's just wait till next week. And they were honest. They called and said, good thing I didn't come and we do our training because I've got COVID. Oh yeah, COVID. COVID's still around. Don't get it twisted. It's alive and well. It's not killing thousands of people, but it is still deadly in some people, and it does still make us sick and regret that we ever got it. Okay? Now, so hand washing, making sure that you kind of distance yourself, right? Let's look at doing a little bit more than that. Let's not be all up on each other in the line in the grocery store, okay? When I go to Trader Joe's, we still have a big old space between us. I think it's out of habit now. But we used to be like right up against each other in line or whatnot. Put that cart between you, honey. And what did I tell y'all? Y'all hard-headed. The best thing to do is to get that Zicam, because this is zinc and vitamin D3. About 2,000 units a day for most people works. It does for me anyway. So zinc, vitamin D, stay away from sick people, eat healthy. Yeah, I know. Here's what you're not going to like me so well for. Remember what I've always taught you. Infection and cancer cannot thrive or grow with sugar. So stay the fuck away from sugar. Not completely, but a little bit. Just pull back, okay? Just stop the madness. Y'all be all up on some sugar. I'm like a modified keto kind of girl. I try to stay away from all the sugar. I love you guys. I hope this helps. Holla back. Deuces.